Hi everyone, welcome back to the channel. I'm Drew with Let's Talk Something, and today do I have a lot of news coming out of right here in New York. It's been a whirlwind of updates and news. I believe this is like my third or fourth video that I'm going to be putting out. But by the time you've seen this, it's going to be the 16th. We have news of a newborn baby who tested positive for the outbreak. We're going to talk about New York City school closures, CDC new recommendations, and the Federal Reserve. But before I get started, can you please like, share, subscribe, and hit that bell icon. Now I'm going to jump right into it. This is coming out of NBC News. As U.S. cases of the outbreak climbed well past 3,000, New York City announced Sunday that it will close public schools Monday, and state and city are ordering bars and restaurants to close to encourage social distancing to try to stem the outbreak. Which, if you have watched my previous video, I talked about this, how people that just don't give a damn is actually hanging out in bars. They're filling up bars, and some restaurants, just, life just goes on for them. And I could understand some people's like, hey, I'm not panicking about this. This is just like any other thing, like the flu or whatever. So some people's just like, whatever. It is what it is. Some people do have a point, like one of my friends told me, and my dad as well. He said there's a vaccine for the flu, and yet people opt not to take it. And that's something I've been saying too. There's a lot of people that don't take the flu vaccine, including myself, for years. Last year was the first time I took it in about 15 years. So this is something that, it happens. And even when they do come out with a vaccine for this, there's people that will opt not to take it. It's a given. New York Governor Andrew Cuomo announced Sunday evening in Westchester that Westchester, Nassau, Suffolk, and New York City schools will close this week. Cuomo also said in a statement that New York City must put a plan in place to make sure that children who rely on school meals will still get fed, and that parents, especially health care workers and first responders, will be provided child care. I understand exactly what he's talking about. I see that on the news all the time, how there are children who live in shelters, who the only meals that they have for the day is what they get in school most times. I've seen them do countless reports on that on different news channels here in New York. So I know that is something that always happen, especially for the school that's right here across the street. They're always giving stuff away to parents, canned goods and food. So I know that is something that actually happens, and I understand why Cuomo wants these things in place, and also the healthcare for the first responders and healthcare workers. I understand why he wants them to have their kids in daycare so they can continue working and serving. So that is something that is necessary. In a news conference Sunday, Mayor de Blasio said schools will close Monday and remain closed at least until April 20th. The mayor said there is a chance schools could remain closed for the rest of the school year. Now, this is something I agree with. I think it should just stay closed for the rest of the school year. For the rest of the school year, just close it down. If you're gonna close it for the rest of the school year, or like he originally said, maybe for the rest of the calendar year until they come out with a vaccine. Because closing schools for a month 6 weeks, whatever, and then you send them back out there, and the virus is still around. What difference is that going to make? You just postpone them, the chance of them getting it for a couple of weeks, and then send them back into the world where it's still out there, and it's probably going to be even more widespread by then. Because the mayor already said that he expects New York to be over 1,000 by this week here, and before it was even Monday, they were already announcing that in New York we already had over 700 cases. So that is something that he predicted and is there. So if it's spreading that fast, imagine what's going to happen by April 20th. Two emergency medicine doctors in New Jersey and Washington state are in critical condition as a result of the outbreak, reinforcing concerns that the nation's frontline medical workers are becoming especially vulnerable to the virus. The American College of Emergency Physicians said. So even the healthcare workers are getting this stuff, and I've been hearing about that here too. That they've been quarantining doctors and medical staffs. So that is not a surprise to me. If even as I reported in one of my old videos that I did just yesterday, that in Coney Island there was a FDNY captain who tested positive for the outbreak. So it's not surprising me at all. Emergency room represents a busy intake point for hospitals where patients come in with symptoms but no diagnosis. As the outbreak spreads during the typical flu season, emergency physicians are triangulating large numbers of patients around the country with symptoms that could be that of the outbreak. As compared to anyone else at a hospital, you are operating with the most incomplete information, said Dr. Angela Fusora. I'm sorry if I'm messing up her name. An emergency doctor in Atlanta. So, with all the mixed information that's coming out, some like Dr. Oz, sounding so sure. Then like I said, every day there's a different specialist on these news channels. Sorry if I'm like drifting off. I am so tired. It's like 4 a.m. here. But yes, he's sounding so sure. But then you have people who actually specialize in infectious diseases who are saying a completely different thing. And there's so much information out there. Like as I said before in my old videos, if you haven't seen those yet, you can go and watch those. I will have some of them in the link in the description. The Federal Reserve slashed interest rates to near zero and unveiled a sweeping set of programs, including plans to snap up huge amounts of government and mortgage-backed debt in an effort to backstop the United States economy as the spread of the outbreak poses a dire threat to economy growth. Now we all know this. My cousin, other people that you've seen on the news talking about how their 401k looks like they just started it. People who had hundreds of thousands, or even 100,000, even 50,000, even 10,000. The money is basically is non-existent. That money is gone. So right now, people's 401k and pension is not there anymore. The outbreak has harmed communities and disrupt economic activity in many countries, including the United States, the central bank said in a statement on Sunday. The Federal Reserve is prepared to use its full range of tools to support the flow of credit to households and businesses. At a news conference on Sunday afternoon, President Trump congratulated the Federal Reserve for its slashing rates to nearly zero. The centers, okay, yeah. So that's what they did. Hopefully, we don't need another recession. So hopefully everything is fine. I know the people that are getting hurt the most are these mom and pop shops or restaurants. The people is the small people that's going to get hurt the most. And hopefully things just pick up faster. But of course, with this thing going on, a lot of people is staying in, just watching Netflix and streaming on Sling. The Center for Disease Control and Prevention recommended Sunday that no mass gatherings with 50 people or more, including weddings, festivals, parades, concerts, sporting events, or conferences, be held in the United States for the next 8 weeks in one of the federal government's most sweeping efforts to slow the spread of the outbreak. Now, I I agree with them lowering it because I remember before it was 500, and you have these rich folks like Vince McMahon who is basically at this point refusing to cancel WrestleMania or postpone it for a later date. There's rumors going around that he's doing that for insurance. So if the CD themselves cancel it, then they because they're insured, they would get paid instead of they if they cancel it, then they lose out the money. But for a company that worth that much, can you actually play God like this? Why are you playing God with people's lives and those people who might potentially show up? Why are you playing with your life like that? And also the UFC, Dana White, the president of the UFC, also is trying his best not to cancel anything. He wants to put on all the shows, including one coming up this Saturday. He said business as usual. These are rich people that don't care. I'm sure, or maybe I'm not gonna say I'm sure, but he probably wouldn't even be there. Probably gonna be in the safety of his hideaway, away from the public. So, and away from mass amount of people. But to each his own. All these rich bastards is gonna get what's coming to them eventually. Maybe they might end up getting the virus themselves. Scores of anxious passengers said they encountered jam-packed terminals, long lines, and hours of delay as flights from more than 2 dozen European countries were routed through 13 of the busiest travel hubs in the United States. Airport workers queried them about their health and instructed them to self-quarantine as part of the enhanced entry screening announced Friday to slow the spread of the outbreak. Airports nationwide were thrown into chaos this weekend as workers scrambled to roll out Trump's administration hastily arranged health screening for travelers returning from Europe. So at the airport, all these people are. I'm seeing on the news videos of all these people crammed up when they're supposed to be all, you know, telling people not to be in these large groups, but you see the airports are crowded because of these screenings, and some of the people are worried because some of them may not have it, and some in the crowd do, and all those people are now being affected by this outbreak because they're close to someone who does have it. So this, I understand why it's being done, but and maybe there's no other way for them to do because they don't want to just release them into the world per se and have them infecting everybody else out there who may not be. So I don't know, maybe they should come up with a better plan to do this where they don't all bunch up because it defeats the purpose of what you're telling us not to do. You're forcing these people to be in large crowds. A newborn in London has tested positive for the outbreak. just minutes after being born to a mother who was also infected with the virus, according to news reports. Days prior to giving birth, the woman was admitted to the hospital for symptoms of pneumonia, finding out she had tested positive for the virus only after her baby was born at North Middlesex Hospital in Enfield in North London, The Guardian reported. This thing is not, this thing is just attacking all ages. Okay? This virus don't care about race, gender, sexuality. Everybody's getting attacked. A newborn baby just came into this world and already has this thing. It's serious out there. It's serious out there. There are at least 3,244 confirmed cases of the outbreak in the United States and at least 61 outbreak-related deaths in the country as of Sunday. So now we're up to 61 here in the States. Globally, there are more than 162,600 confirmed outbreak cases and more than 5,800 deaths, according to data compiled by the Center for Systems Science and Engineering at Johns Hopkins University. It hasn't reached flu-like levels as yet, but we're in the third month and we're basically, I would say, about halfway there of what the flu does in 1 year. So in 3 months of this year, we are already where the flu wouldn't even be as yet in killing us off. So when these infectious disease scientists are saying that this thing could be 10 to 15 times more deadly than the flu, I completely believe them based on the data that's there right now. And hopefully, as I said, even though I don't trust what he's saying, I hope Dr. Oz is right and that this thing slows down in warm weather. But also, one of the infectious disease scientists that I was watching on the interview with Joe Rogan, he was saying that yes, it might. There's no evidence of that, I believe he said, but even if it slows down in warm weather, when cold weather comes back, you could see it spreading. Right, you could see it spreading again. You could see China, even though they're opening up for business again, it might start spreading again. Because it might start spreading in China again. So who's to say that just like the flu, this wouldn't just keep coming back? So now we're going to have the flu and we're going to have this outbreak as well on our hands until there is a viable vaccine. Hopefully the vaccine does what they're intended for it to do. Hopefully there is a viable vaccine. That's it for this video. I'm Drew with Let's Talk Something. Please like, share, subscribe, hit that bell icon, and leave all your comments down below. See you guys on the next video. And now I'm going to sleep. I'm tired as shit.